Hi, my name is Christina Carlson. I am a student at West Coast University. I currently live in Southern Orange County. I have hopes to graduate and become a emergency room nurse.
Hi, my name is Megan Geyer. I'm 21 years old and I transferred to West Coast from San Diego State, hoping to pursue my career as a nurse. I would love to be a pediatric nurse, so we will see in 7 months when we graduate where we will be. So to start off our presentation, we did it on cystic fibrosis. So I would like to define the disease, and ATI describes it very well. So cystic fibrosis is a respiratory disorder that results from a mutated gene. So this gene is transferred from the mother and father. They have to be carriers of the disease in order for their children to develop it. This disease of cystic fibrosis is characterized by mucus glands that secrete an abnormal amount, especially an abnormal amount of thick, sticky mucus, and it is found mostly in the lungs, but it can also be found in the pancreas, liver, small intestine, large intestine, as well as the reproductive system. And then some symptoms that can be found. The first sign of cystic fibrosis in newborns is meconium ileus. So if they haven't passed stool by the first 24 hours, then this should be of a concern to for the patient. And then after, if they haven't developed it in those first 24 hours, then other signs can be wheezing, a dry cough. There may also be hard time breathing, mucus plugs. So if anything that they have mucus in their chest, that can also be a sign, as well as cyanosis as a long-term effect, a barreled chest, and then clubbing of the fingers. So to go on from our article, the article we found is Cystic Fibrosis in Young Children, and it was a review of the disease manifestations as well as the progression and response to early treatment. A few of the authors were Donald Van de Vanter, Jennifer Kale, and Amy O'Sullivan. The article we found was from the Journal of Cystic Fibrosis, and it describes the illness process, including the manifestations, and then the treatment of the disease, and we will see later how important treatment is.
The methods that were used were data collection through studies of children with cystic fibrosis less than the year of 6 years old. The study included the digestive and respiratory abnormalities of the disease in children. The results of the study revealed that the disease processed from infancy to childhood, but it improved with early diagnosis through a newborn screening versus waiting until later to be diagnosed because of the present symptoms. Therefore, it was concluded that cystic fibrosis that is apparent at birth will have better outcomes than children that have been diagnosed later on in life.
So there were many positives and strengths to this article. One of these strengths being that this article reviewed many different articles and studies and put them together. So this provides a wide variety of information. In the article, another strength provided tables and diagrams, which are very easy to visually learn, and versus reading paragraphs of information, the charts were put in the article, which were easy to understand.
With strengths, there do come weaknesses. There were a couple limitations to this article. The fact that there was no clear hypothesis stated was unclear to the reader to know what the study was clearly researching. The researchers didn't put in specific sections of the article that clearly discussed what was being reviewed and what different parts of the article were discussing. You really had to search through the article to get a clear understanding of what exactly was being discussed.
And the article's public health implications were to educate the public about how important early diagnosis is for prevention of progression of cystic fibrosis. And the scientists performed this study to educate the reader and the audience about cystic fibrosis symptoms, so to educate what to look out for, their manifestations, and then how important early detection is for these patients developing cystic fibrosis.
According to the researchers, cystic fibrosis is a life-shortening, multi-symptom genetic disease, meaning that there are no exposures that precipitate this disease simply because it is a genetic disease. However, there are environmental exposures that can exacerbate the symptoms of this disease. These exposures include secondhand smoke, pathogens, and microorganisms. These exposures can significantly be detrimental to the outcome of the child with cystic fibrosis.
In this article, there weren't any clear hypothesis of what was reviewed. The researchers were simply reviewing previous studies that had been constructed and putting a simplified version of those articles. They wanted to compile the information to come to a clear conclusion of the respiratory and digestive systems that are affected by cystic fibrosis, especially under the age of 6 years old.
A major technique used in this study was data collecting techniques. There were 3 large databases that were used to collect literature in the English language from the months of June to August in 2014 of information compiled for children under the ages of 6 with cystic fibrosis. They used this information to decipher what they wanted to study and review. The researchers strategically had to sort through the information to get rid of duplicates as well as get rid of information that they deemed unreliable for the fact that they were outdated or the study was no longer valid.
Now the results concluded in quotes that literature exists the outcomes in children of 6 years of age and younger relating to all 3 of the research questions for both the cystic fibrosis, digestive, and respiratory systems. There was significant evidence that showed that there were organ abnormalities in children with cystic fibrosis from infants from 6 to 6 years of age. The studies also concluded that respiratory and digestive systems, there is impairment that these impairments have significant impact on the respiratory and digestive system.
We chose this article because we found it really interesting. In our theory class, we are in pediatrics rotation right now. We're learning about cystic fibrosis, and we decided that we wanted to learn more information on this topic. It was interesting to review all the studies that were compiled in one to really see how it was laid out for children under the age of 6, the manifestations that they have and their presenting signs and symptoms. However, the article was uneasy to read and know exactly what was being written about. There was no clear question to be addressed, and the hypothesis wasn't written.
And then we learned a lot from this article. It was very interesting reading it, just as Chrissy said that we are in our pediatric rotation right now. We learned that cystic fibrosis affects more than just the respiratory system. It can affect a lot of systems throughout the body, and it affects them on a cellular level as well. So we also learned that the outcomes of the disease may be compromised due to environmental factors, and that we would like our audience to know a clear understanding of what cystic fibrosis is, what symptoms to look out for, the manifestation, the treatment that we will soon go over with Chrissy, and then just how important that it is good to look out for children under 6 years of age.
Lastly, we'd like to review again the symptoms that Megan stated previously and also the treatment for cystic fibrosis. Here's a little handout that we have. The symptoms include fatigue, chronic cough, sticky mucus, chronic hypoxia, and much more. And then as far as treatment is, we'd encourage the patient to have a high-calorie, high-protein diet, pulmonary therapy, such as chest physiotherapy, breathing exercises, and as well they'd be prescribed medications such as antibiotics, supplemental vitamins, aerosols such as bronchodilators, mucolytics, and pancreatic enzymes to help with the digestive system.
So thank you for listening. We hope you learned a lot and enjoyed our presentation.
Thank you.
Thank you.